Now let's study the second process, the distribution. First, see the figures to understand what is distribution. We know when a drug enters into the circulation, it means the drug is entered into the body, and then the drug is first will go to the circulation. Most of drug will in the circulation, and followed the circulation, it can enter into the different tissues, different organs. This process we called distribution. So the distribution is the movement, still the movement of drug from the blood, from the circulation to different parts of the body. That's a distribution. From where? From the circulation. Circulation is the ending of absorption and is the beginning of distribution, and then go to different parts of the body. You can see here. Yeah, from the blood to the tissues. And also from the different parts of body back to the blood. So distribution, after distribution, the drug in the blood will also will back to the blood. This is distribution. And the factors affecting the distribution will include, you can see, the degree of plasma protein binding in the cell membrane barrier, and also others like the difference in the regional blood flow and the degree of tissue protein binding and the other pH or other specific transporter. Let's first see the first factors. Plasma protein binding. Of course, this protein exists in the plasma, so we call them plasma proteins. And this protein can bind to drugs. And after the binding, the drug will form the freely, you can see, the free drug and become to the bond form. And they have different characters. Unbound drug is different from the bound drug. First difference, of course, that because unbound, this is free drugs, and when it bind to protein, will become bigger. So this is the first difference. This is a smaller form, and this is a bigger form, a very, very big form, because protein have a large volume. And the second difference, unbound form have effect, and the bound form will lose effect, because we know the drug is a chemical, and when it's binding to protein, maybe the band site will disappear, will be covered, so will lose the effect. Next one. Next difference. Unbound form can be metabolized and can be eliminated. And the bound form, because it have a very big volume, so it's hard to cross membrane, and thus it's very hard to be metabolized and very hard to be eliminated. So we can regard the bond form as a temporary storage of a drug. Why is temporary? Because this binding, you can see here, this binding is reversible. Yeah, it can from the unbound form to the bound form. It still can be the bound form to dissolved and back to the unbound form. And this is balance. Okay, so this is plasma protein binding affect the distribution. After binding, the bond form is hard to cross membrane, so it's very hard to reach the tissues and hard to be metabolized and hard to be eliminated, and temporarily lose its action. This is bond form. And next, we should see some plasma protein that can bind the drugs. One is albumin. Yeah, albumin. Albumin can bind to acidic drugs. Yeah, it have a high affinity to the acid drugs, like the penicillin, like the warfarin, like the aspirin. These acid drugs. And the basic drugs is have a large affinity bind to alpha-1 acid glycoprotein. Yeah, these drugs include the prozolin and the quinidine and the beta blockers. Yeah, so here you should get a conclusion. What conclusion? Acid drugs and basic drugs, they have different plasma protein. Yeah, this is the conclusion. So they cannot compete the binding of each other. Yeah, acid drugs and basic drugs, they have different protein, the plasma protein, so they cannot bind to the same protein. They have no competition between each other. Okay, this is for the plasma binding and different bindings. And after that, we should know some clinical implications. Let's see it. Bond form. When a drug binds to the plasma protein, the complex will become big. This is bond form. So the bond form cannot cross the membranes. It will limit it to the vascular compartment, will still stay in the blood, cannot come to the tissues. And the second one, the bond form is a temporary storage, so it will temporarily lose its action. And after the drug dissolved, after the drug separate from the complex, it will restore its action. The third one, the bond form have a longer acting. Yeah, slowly separated. So the latent period, the last period will become longer. And the last one, the bond form is very hard across membrane, so it cannot available for metabolism or accretion. Because metabolism will enter into the liver, and accretion, it means the drug will enter into the kidney. but it cannot get to this tissue, so cannot be metabolized or aggregated. This is bound form. Bound form. Okay, after we understand the character of bound form, we should know other two phenomena. One is saturate. Another one is competition. Because the plasma protein is very big, complex. So, if this functional protein, this is protein, all of the protein have these two phenomena: saturation and the competition. And you know, I have described that like the carrier. Yeah, have you remember that? Carrier also have these two characters, saturate and compete. And here, the plasma protein also have that. And that will give us some clinical implication. Oh, let's see it. First one, the drug displacement interaction. It will refer at least two drugs. And both of the drugs can bind to the same plasma proteins. Okay, you should know the condition. Yeah, these two drugs can bind to the same plasma protein, so they can compete each other and exist the displacement interaction. Once a drug that have a high affinity to the plasma protein, it can displace the other drugs that have a weak affinity to the protein. That we call displace interactions. You can see here, if 1% of drug displaced from the 99% bound form, the free form will increase very quickly, and then its action, its effect include the therapeutic action and the adverse action. Both of that will increase. So it reminds us when we in the clinical trial, the application, we should notice these two drugs. If these drugs have the displacement interactions in the plasma protein binding, if they have, maybe the drug that have a high affinity can make the drug that have a low affinity, the amount will decrease very quickly. It's very dangerous. Because not only therapeutic but also the adverse action were produced. You can see here. Like what? Like probenecid and indomethacin. Yeah, both of them can bind to the albumin. So the indomethacin will increase the free form of probenecid and increase its action. And here is other important displacement. Let's see, especially like this. Let's see. Salicylic acid will displace sulfonylureas and increase its toxicity. This also, its mechanism also refers to the displace interactions. And indomethacin will displace warfarin and increase the bleeding toxicity of warfarin. Yeah, this is all the important displacement reactions. And now we should notice this sentence. Acid drugs generally do not displace basic drugs because they have different plasma protein. Yeah, have different, so they cannot compete with each other. Okay, this is for the first clinical significance under the influence of plasma protein binding. Yeah, the displacement interactions. Next one, in some pathologic conditions, like some liver disease and some kidney disease, you can see here. Yeah, they can induce hypoalbuminemia. So yeah, it will decrease albumin and decrease the binding to what drug? To the acid drug. Yeah, the protein decrease, the binding decrease. That means the free drug, especially the acid drug, will increase, and its effect will increase. That means when the patient suffered liver disease, we need use the less drug, and to avoid the increased action. Okay, this is implications. And others like the inflammation, it also will influence the plasma protein binding and influence the free dose of drug. Influence that. Okay, last one. Some special period like the pregnancy, the plasma protein binding will increase in the pregnancy. So if you will give the drug to pregnancy, you need increase the dose to reach the certain action that equal to the normal patient that we not is pregnancy. So this is the clinical application. The disease, another drug, and some special period that can affect the plasma protein binding, and finally affect the free dose of drug. So we need to understand how to adjust the dose, of drug in different condition. If two drugs exist, the displacement interactions, we should decrease the drug that have a low affinity. You right? Yeah, we should understand the clinical significance. Now let's see this question to understand the displace interactions, how to adjust the dose. Okay, every student see this question. A patient is treated with drug A, so drug A will give praise, and then have a high affinity for albumin. And then we give what? We give drug B. Drug B also have affinity for albumin and have a very high affinity. So which the following occurs after administration of drug B. It means this question will let you to answer what's the result. Refers to drug A after the administration of drug B. Okay, do you understand that? Do you clear about this question? Now let's see it. Let's see it. The correct answer is this one. Okay, let's see why. Let's see why. Because first we give drug A. A can bind to the albumin. Because they have a high affinity to albumin, so most of drug A will bind to here. And then we give drug B. Here you should understand drug B, we give drug B, not give the drug A more. Not give drug A more. So the total amount of drug A in the circulation is steady, not change. And the total amount of drug A includes what? Includes the free form and the bound form. Free form and bound form, and they not change. So B is wrong. The volume distribution is not change. And after the administration of drug B, what happened? Because drug B, you can see here, 100 times the binding capacity of albumin. So drug B, maybe drug B will take up this binding site that is same to the drug A. So drug A, you can see, drug A, what happened? Will lose this binding and become to free drug. So you can see the total amount of drug A is not change, but the free form is increase. So the bound form will decrease. After that, because free form is increase, and this form have a very good lipid diffusion, so it can get in some tissues. That means the dose of drug A in the tissue will increase. Okay, and bound form have a very poor penetration, cannot go to the tissue. So free drug increase, and more drug can get into tissues. The choice C is correct. Here, clear or not clear? Clear or not clear? If not clear, I can explain that once more. Okay, clear. Let's see other factors that influence the distribution, like what? Like some cell membrane barrier, very especially blood-brain barrier, blood-CSF barrier, and the placental. And they have a tight connection between each cell, so will make the membrane transport of drug become hard. You can see here, only some lipid-soluble drug can enter the brain, can enter the CSF, and also can pass by the placental. You can see the blood-brain barrier. This is the normal tissue, and this is the brain tissue. It become more tight become more tight. So it will block the transport of most drugs. Only the lipid-soluble drug can cross the membrane from the blood to the tissues. Okay, next one. In the blood-brain barrier, some drug can cross that, and some not cross this. And in some region will deficient of blood-brain barrier. So in this condition, the drug can cross membrane easily. And the blood-CSF barrier also like this. This is the principal barrier. So especially in the earlier pregnancy, the drug is very hard to cross membrane and go to the fluid and influence the fetal. But after later period, this barrier become more thin and most drug can cross the membrane. That's danger. Okay, next factors is difference in the regional blood flow. You can see because the organ have very high blood flow, so the drug can enter into this tissue firstly, and then drug will get into the tissue, the organs that have a low blood flow. This we called redistribution. Next effect is tissue storage. It means in the distribution, some drug can bind to some special tissue because they have an affinity to this tissue. Like this one, thyroid. Iodine can storage mostly in the thyroid. And diagnosing can accumulate it in the kidney and the liver because they have a high protein binding, the tissue protein binding to this tissue. And because a drug can bind to some special tissues, that means in most the drug, more and more drug can lyse on these tissues with very high concentration. And one side, it maybe can take some therapeutic action. And the next side, maybe it will produce some very high toxicity. So be careful about that. Last one, let's see a pyramid that describe the distribution. This pyramid is apparent volume of distribution. It can short for VD. First, let's see the definition. It means the volume required to accommodate all drug in the body if the concentration throughout the body was the same as in the plasma. What it means? I have said to you, distribution. After distribution, the drug can flow from the blood to the tissue, and also can from the tissue back to the blood. Yeah, this is a cycle. And when the speed of the transport is the same, here we can calculate a pyramid according to the plasma concentration and its volume. This one we called what volume? apparent volume of distribution. Okay, so you should first understand here have a condition. Now let's see if this condition is achieved. We use the plasma concentration that is equal to the concentration exists in the tissue. The volume is the value is equal. So we can use this one to calculate the apparent volume. You can see the equation. Vd is equal to the total amount of drug in the body. Okay, not administrative dose. This is a dose in the body. And then divided to the concentration of drug in the plasma. And here, the concentration of drug in the plasma is equal to the concentration of drug in the tissue. Because we have reached the condition. And this is Vd. Here, when we calculate the Vd, this is not actually Vd in the tissue. This is apparent volume of distribution. We use the plasma condition as one concentration as one condition. So let's see the clinical importance. Okay, first let's write the equation. Let me see. This is the dose in the body, and divided to the concentration in the plasma. Okay, this is equation. Let's see. When the Vd is very small, because the dose in the body that does not change. When a drug come into the circulation, come in our body, this keeps steady. So when the Vd is very, very small, it means what? It means the concentration of drug is very big. Yeah, very big. Concentration in the plasma is very big, so the drug stay in the plasma. Okay, and when the Vd increase, it means the concentration of drug in the plasma will how to change? Will decrease. Will decrease. Because this is steady, so this one become less, this value will become big. It means now the drug will float from the circulation and to the tissue, and maybe will to the intracellular region. So you can see when the Vd becomes more and more large, this value become larger. It represents the drug will flow from the circulation to the tissue and even to the intracellular site. Okay, this is the clinical implications of Vd, the apparent volume distribution. You should understand it well. This is an example for you to calculate the Vd. Let's see it. When we give a drug, this is IV, is 500 mg. Because this is IV, so 5 mg means the concentration of drug in the body is 50 mg. Okay, and then when the distribution become balanced, we measure the concentration of drug in the plasma. This is 10 mg per liter of plasma. So we can calculate the Vd is equal to 500 mg per 10 mg per liter. So the unit is liter, and the value is 50. Yeah, 50 liter. The VD, apparent volume of distribution, is 50 liter. 50 liter. Okay, if you understand, let's do some calculation. Do some calculation. You need to understand how to calculate it. This is not time ending. Come back. You should keep it on some time, okay? Still have all students is leave. Okay, very good. This is the correct answer. Let's see it. This is IV, and 100 mg. So 100 mg divided to here, the plasma concentration. We need to change the unit to mg per liter. So this is equal to mg per liter. So finally is 5 liter. 5 liter. Here you should transfer the unit from the mu mg per m liter to mg per liter. If you can change it correct, and the answer is correct. The answer is correct. Okay, next one. Yeah, an agent is noted to have very low calculated VD, which the following is the best explanation. VD is very low, maybe just this one. What's the answer is correct? Which answer is correct? Okay, let's see. A, the VD value is very low. It represents the concentration of drug is very big. Yeah, the concentration of drug in the plasma is very big. So most of the drug is stay in the blood. If you understand that, let's see the choice. The agent is emitted by the kidney. No. And the agent is extensive bound to plasma. So most of the drug is still in the blood. So this is correct. B is correct. And the agent is extensively sequestered in the tissue. No. If this value is very big. Yeah, very, very big. And the agent eliminated by not refers to this. So B is the correct answer. B is the correct answer. Okay, for this, give you some summarize. Because today we have learned 3 content. Let's review. The first one is memory transport. Second one, absorption. And the last one is what? Distribution. So you can first to master the definition of absorption and the first pass metabolism, bioavailability, and apparent volume of distribution. Of course, I+1. The definition of distribution, you still need to master that. Second one, the calculation. Calculation VD and calculate the fraction, the bioavailability. Okay, next one refers to what? Refers to the memory transport. Like which type is the most important, and what's the influence of pH of memory transport? and what a difference passive and active transport. Last one, you should understand some significant, some clinical implications. One is plasma protein binding, especially the drug displacement interaction. If I give you two drugs that both of them can bind to the same plasma protein, what will happen? What will happen? And next one, know the apparent volume distribution (VD). I give you the VD is very, very low or very, very big. What's the implication? What's the implications? Okay, you should understand that. Okay, today is finished. I give you rest.